the secret proposal that broke the law. On February 5th, 2025, the Jefferson Healthcare Board went into executive session citing the real estate exemption of the Open Public Meetings Act. Instead of real estate, we were shown a plan to form a private nonprofit corporation, the Peninsula Health Alliance, with CEO Mike Glenn as administrator and a 12-member super board with 7 seats for OMC and 5 seats for Jefferson, giving Clallam County instant majority control. When I asked if he was seeking board approval, the CEO said yes, and one by one the other commissioners voiced support. That was an illegally held secret deliberation and an illegal straw poll taking action outside public view. At a second executive session, the CEO described a strategy of eventually releasing the proposal to the public, but only after Jefferson and OMC had agreed in principle to proceeding with it. They called this strategy setting up a binding, non-binding agreement, and the hospital attorney present at that meeting gave advice how to accomplish this neat trick. In the weeks that followed, I warned my colleagues the session and process was unlawful and unlawfully hidden from public view. My own attorney and legal research indicated we were getting seriously flawed legal guidance from the hospital attorney, who said it was okay to hide these talks under the guise of real estate discussions. They dismissed my concerns and refused to seek a second legal opinion. At the same time, the CEO and board publicly denied the proposal existed and insisted the February 5th session was only about real estate.
That executive session, the issues we were talking with the board about related to the possible acquisition or transfer or lease of assets.
We were considering the possibility of leasing some property, and that is one of the, as it turned out, we didn't get that far when we talked about it because our time ran out.
I need to know if the topic of, if we're going to discuss major governance changes, major partnerships or alliances with other institutions, that topic is not covered by executive session. Just that it tangentially might involve a real estate transaction at some point is, I think, really stretching the real estate cover for executive session. If we're talking about major partnerships or alliances actively, I would like to know when we can discuss this publicly. I would like to discuss it with people that care about healthcare in our community so that we have an informed public. So are we allowed to talk about potential alliances that we're exploring or working on in any way?
Yeah, Matt, there's really nothing to talk about right now. If additional discussions regarding regional alliance opportunities emerge, then yes, those discussions would be held in appropriate venues and forums. Okay?
This is all just speculation. There's nothing, it was a conversation and there's nothing really to talk about because we talked about some possibilities, but until there's other conversations that go on and it comes and we decide whether we're going to do something or not, there's no vote on it. So I don't know. Matt, I don't know what you'd have to really talk about because there's nothing definitive to talk about. No decision's been made on anything.
A pretty concrete proposal was drafted. It's a preliminary proposal, but that was shared with the commissioners in email, but we haven't talked about it with the public. I think it'd be good to talk about it with the public.
Look at it later on when there's something maybe to look at, because right now it's airy-fairy and of no consequence.
These statements about the status of the proposal and the executive session were highly misleading, if not fraudulent, deceptions of the public. A 60-page proposal had been submitted to OMC and accepted into the second round of their evaluation process. That was the truth, and the public had a right to know that, since the board had no right to hide it behind the cover of a real estate exemption. I would not be complicit in deceiving the public over such a sweeping proposal, so after careful and painstaking deliberation, I filed a criminal complaint with the sheriff and reported the violations to the state auditor and reported the advising attorney to the Washington State Bar Association. At the March 26th meeting, I tried to tell the public, and the chair cut off my microphone twice, including during public comment.
Well, I regretfully need to inform the public that Jefferson Healthcare is in secret negotiations with Olympic Medical Center to create something called the Peninsula Health Alliance. This proposal and negotiations have taken place without
Point of order. Point of order.
Yes, you
Or
are
permission.
out
Point
of
of-
order.
Point of order.
Yes, this is something that was discussed in executive session, and you cannot divulge this.
And if I could add that that's
Yes.
that's a violation of our ethics, and whether
Okay. Okay, Matt, I don't know, this is kind of unconventional, but I assume you're putting a public hat on now?
Sure. I want to talk as a member of the public.
All right, 3 minutes.
It has come to my attention that Jefferson Healthcare is in secret negotiations with Olympic Medical Center to create something called the Peninsula Health Alliance. As a member,
This
of
is
the
an
public,
you are saying things that are unsubstantiated and bordering on libel or slander at this point. So I really am not going to allow this. Muted, Katie.
I would like to make a motion to close public comment.
So there's a hand up, Nat.
thanks for that presentation, Mike. I agree. The landscape of healthcare is very challenging indeed. But, for that reason, I think it's important that public hospital districts act with integrity and honesty and appropriately transparent with the public. If Jefferson Healthcare has submitted a proposal to Olympic Medical Center in response to their public request
Matt,
for proposal, then
Matt,
that would not be with the approval
I
of the
am
board
cutting you
and would
off
be
right now.
an illegal.
Matt, stop.
So,
You are out.
so there
of
are questions
your-
that I can answer. Any questions or comments by commissioners about something that I can talk about?
Can you imagine the mayor cutting off the microphone of a sitting city council member during their allotted time to speak as a representative of the people? If our meetings were not recorded, then you may have never heard about this incident, and this abuse of power may have succeeded in keeping this illegal secret negotiation hidden. Thankfully, the Port Townsend leader listens to our meeting recordings sometimes. They investigated and broke the story. The sheriff's office later concluded the board had likely violated the OPMA, the state's Open Public Meetings Act. Only after the press exposed the proposal did the CEO and commissioners admit it existed, claiming secrecy was required by a non-disclosure agreement. This admission occurred finally at the June 18, 2025 board meeting.
We will now go into our discussion of the Peninsula Health Alliance proposal. It's a little background. The public has read and heard about a proposed alliance between Jefferson Healthcare and Olympic Medical Center. It is true that we were considering such a proposal in the hope that we could work with our neighbors to help both of us thrive in this time of uncertain financial climate. Part of the proposal process was a confidentiality agreement that is typical in these circumstances and which we agreed to. 4 commissioners have complied with the agreement, 1 did not. We have lost our opportunity to develop the proposal into an actual plan, which we would have taken to our community for discussion before any commitment to the plan was made. While the lone member brought allegations against the rest of the board and the CEO, we continued to honor the confidentiality agreement.
Only after the press exposed the proposal did the CEO and commissioners admit it existed, claiming secrecy was required by a non-disclosure agreement, NDA. But an NDA is a private corporate tool, not a shield for public officials. It cannot override a public hospital district's duty of transparency. The law defines the public's right to know. 2 CEOs cannot just get together, sign a piece of paper, and suddenly public records are no longer public records. The commissioners claim they never voiced approval to the CEO for the proposal, nor authorized him to submit it during the February 5th executive session, as I have testified. By their account, this June 18th meeting is the first moment the commissioners ever expressed any opinion about the proposal to the CEO. Yet, remarkably, Commissioners Kolff and Bueller had already drafted a letter for the board to approve before this meeting, a letter that declared they all were satisfied Jefferson Healthcare could benefit tremendously from such an alliance.
An official board letter draft prepared by Commissioners Bueller and Kolff is a starting point. So this is to the residents of East Jefferson County from the Board of Jefferson Healthcare regarding the allegations and misstatements by Commissioner Matt Reddy. Commissioner Reddy has accused his 4 fellow commissioners at Jefferson Healthcare of violating the Open Public Meetings Act, OPMA, with regards to its involvement in CEO Mike Glenn's preparation and submittal of a response called the Peninsula Health Alliance Proposal to Olympic Medical Center's request for proposals. We believed that we were in compliance with the OPMA when we held one executive session in February to learn about the real estate component of the alliance proposal. We believe Mike Glenn acted within his authority as CEO when he submitted an alliance proposal to OMC. At no time did he seek consent on either the content or request permission of the board to submit the proposal during the executive sessions. At no time did he negotiate any terms with OMC. He simply presented the alliance proposal. We were satisfied that Jefferson Healthcare could benefit tremendously from such an alliance. So now we should take a vote on the full letter. All in favor, say aye.
Aye.
Right.
Any opposed?
Nay.
They are clearly demonstrating through the pre-drafting and instant approval of this letter that they already knew before this meeting that every commissioner supported the proposal. How could they have known that without having discussed it beforehand? They knew without a hint of hesitation or need for discussion that they were all satisfied that the Peninsula Health Alliance could benefit Jefferson Healthcare tremendously because they had already said so clearly to one another and the CEO on February 5th, 2025 in the executive session, exactly as I have testified. This entire situation continues to need and thorough impartial analysis by the institution of Jefferson Healthcare so that the board and CEO can learn from it. What went wrong, why, and how can we avoid a situation like this happening again in the future? Leaders need to be able to admit when they make mistakes and learn from them. That is what competent leadership looks like. But the board refuses to hire an independent attorney, instead letting the CEO investigate with lawyers he controls and pays with your tax dollars. But even those lawyers, however, could not dispute what multiple outside attorneys found. The February 5th executive session broke the law. The CEO and board now claim a recent legal memo asks and answers every question I have raised about the NDA. I have the memo, and that claim is false. They refuse to release this memo to the public to read for themselves. Could an alliance such as the Peninsula Health Alliance be a good idea? Yes, but as crafted, it was dangerous. A step toward corporate secrecy replacing democratic oversight. In such a structure, a single vote could have pushed decisions out of public view. Ideas this significant must face public scrutiny from the start, and with a little forethought, we could have easily found a path to do that with this proposal. Jefferson Healthcare is one of the most important institutions in our county, and it provides incredibly high-quality patient care. The concerns I've raised are not about our doctors, nurses, or staff. They're about governance at the top. Public hospital commissioners must lead with integrity, understanding that a public institution is not a private corporation. They must hold their CEO accountable, evaluate the CEO in meaningful ways using the best practice of 360 annual evaluations, and rely on independent counsel to resolve controversies quickly, openly, and fairly. Transparency is not a burden to escape with legal maneuvers or backroom deals. It is the foundation of democracy. Transparency is sunlight that protects us all from the abuse of power. I stand by my record, and if re-elected, I will continue to serve with honesty, integrity, and thoughtfulness as your hospital commissioner. Looking forward, my priority is clear. Keep our hospital locally controlled, financially stable, and always focused on the health of our community. If you'd like to learn more or contact me, visit readyforhealthcare.org, where I've posted detailed blogs about my 11 years in office along with recordings of the meetings I've referenced. Remember, when we shine light into our public institutions, we don't weaken them. We make them worthy of the trust they hold.
Okay.
Well, I regretfully need to inform the public that Jefferson Healthcare is in secret negotiations with Olympic Medical Center to create something called the Peninsula Health Alliance. This proposal and negotiations have taken place without Peninsula Health Alliance. This proposal and negotiations have taken place.
We were satisfied that Jefferson Healthcare could benefit tremendously from such an alliance.